Hello, this is Lauren Gifford, and this is for week 2. And here's my name on paper, Lauren Gifford, February 3rd, 2026. And then on the back is just, all it is the words that we're discussing. Okay. So disease definition. The definition of disease is any condition that affects the function and possibly the structure of the body. So you could say an example of that would be coronary artery disease, or CAD. In coronary artery disease, the blood vessels that surround the heart and provide the heart muscle with blood, the coronary arteries, are affected with plaque that builds up over time and causes narrowing of those vessels, and can, down the road lead to things like heart attack. Disease classification. So you can classify diseases in different ways. Basically, one common way is by what area of the body it affects. So for instance, you would say pneumonia is a respiratory disease. So that is a good example. Etiology is how what's the cause of the disease. So a good example for that would be in influenza. What causes influenza is the influenza virus. So the etiology of influenza is the influenza virus. Pathogenesis is how what happens in the body and how the disease progresses once you have it. So you could say in bacterial pneumonia, you could get something like Streptococcus pneumoniae, and that is a bacteria, and then it gets in the respiratory tract, and it goes into the air sacs, and then causes localized inflammation and mucus and fluid buildup, and then you develop pneumonia. Symptoms. So symptoms are basically anything that's reported to you by a patient. They're not observable. They're so something like a patient coming to you and saying, "Oh, I have a horrible headache." We can't see what the headache looks like. We can't know that they have a headache. That's something that they're telling us they have. And then for signs, that's observable things. So you could get a thermometer and take someone's temperature, and you could look at it as a healthcare provider and say, "Oh wow, that's 100.5. They have a fever." Or in the pneumonia case, you could get your stethoscope and listen to their lung sounds, and you would hear maybe coarse crackles. And so it's just another tool for the following thing, which is, syndrome. So in syndrome, you could, basically what a syndrome is a collection of signs and symptoms that, when you put them together, can form a syndrome. So one example would be acute respiratory distress syndrome. And so different things that are signs and symptoms for that. For signs, the patient could tell you that they're very tired, tell you that they've been coughing a lot. They could tell you that they've been short of breath. And then for signs, then you could say you see them and they look cyanotic. You look at their pulse ox and it's really low. You listen to their lungs and they're very diminished or crackly, or they're starting to be confused. So there's different things that you could put together. Sometimes they have low blood pressure, and you could say that's a syndrome, which leads to the next question, which is a diagnosis. A diagnosis would be taking this information, not necessarily syndrome, but taking the information of signs, symptoms, medical records, maybe medical history, maybe a combination of diagnostic tools or tests, and you come up with a diagnosis. So say someone comes to you and they're telling you that they're really tired, that they had at home, they thought they had a fever, like chills, and then you see them and you look at the chart and you see that last time they were here, they weighed 150 pounds. Now they weigh 125 on the scale in front of you. Their skin is jaundice appearing, and you kind of So you decide to look at their history, and they had a history of maybe pancreatitis in the past, or a family history of pancreatic cancer, and then you do a test, say you do a CT scan, and you see there's a mass on their pancreas and maybe some spots that had spread to the liver. And so then you put it all together, and you might come up with a diagnosis of pancreatic cancer. Obviously, you have to like do biopsies and whatnot, but that would be an example of a diagnosis. And then complications. So complications are basically, it's like extra things that adverse effects that can happen from a disease process. So one thing I thought of for this was when you have diabetes, some people can get diabetic retinopathy, which is vision loss related to chronic uncontrolled glucose or diabetes. And then prognosis, we go back to the cancer related example, and I could say that a doctor might say, oh, you have pancreatic cancer. The prognosis for this is that you only have 3 to 6 months to live, and you might be sick, and all these things. So the prognosis is basically the outlook of the disease process. And then diagnostic tests are things like, in the cancer example, you could say a biopsy would be a diagnostic test, or different labs. You could do tumor marker testing, PET scans. Those are different things to kind of help in your process. And I hope that answers all the questions. Thank you.